When a patient first finds out that they have cancer, it's like a punch to the gut. I myself, in fact, have been diagnosed with prostate cancer. Having had that diagnosis and going through the process that my patients have to go through has been really helpful to my work as a therapist as well. I will have probably a majority of folks will be fearful. They'll be wondering, of course, what's going to be my future. What kind of pain will I be experiencing? If I'm going to receive treatment, whether it's surgery or radiation or chemotherapy, which are all on the table, we have folks who actually aren't necessarily panicked or fearful, but they are concerned about their families. They're concerned about their children. They're concerned and also their spouses and other relatives, other friends. So the first thing I try to do is what's called supportive listening. I invite them to talk about whatever it is that's on their mind, and not to filter their information as they would with maybe somebody else in their lives. Here I say, this is between us, it's confidential. Here you can be yourself, you can talk about your worst fears, you can cry, you can be angry. So I welcome them in terms of expressing those things. After that, the direction that we go is determined by the patient. What many people don't understand is that cancer journey is as much a mental and emotional challenge as it is a physical one. Now, some people would say, well, the physical challenge is dominant. Yes, but for myself, as a person who's being treated for cancer, and for my patients, I know that the emotional turmoil, and sometimes even when they're feeling better, but there's a kind of a script running through their head, in the back of their mind. I have cancer. What's going to happen? Will my future be very different than it is now? And that, if that isn't expressed in a psychotherapy session, if that isn't worked on by the patient, it can start to wear you down. And the patient gets worn down even by thoughts that are in the back of their head, but they're there all the time, so they can't turn it off. Whereas when they come into therapy, they can discuss those things. We can get into those things and talk about them, and they can have, emotional responses, and that gets better. From my point of view, this is a service that not only is needed and should be available to cancer patients and their families, but it's clear to me when I see someone, they really need and want the assistance. With some patients in other settings, job settings, it's not always clear about the urgency or the immediacy of the problem, whereas with cancer patients, it's right up front.